Some of our distinguished guests have a hard stop for another meeting at 14:30. So we're going to try and progress through the slides relatively quickly. And I'm going to ask you to hold your questions until the end of the presentations, at which point we will ask all the four speakers to take a seat on the dais. And we will take as many questions from the floor as we can in the time that we have available. So, good afternoon, ladies and gentlemen. It is a real privilege for me to be here today. My name is Dr. Stephen Mason. I'm the Medical Affairs Director at GlaxoSmithKline. And it's a privilege to be in Argentina, a privilege to be in Buenos Aires, and equally a privilege to be able to chair what I believe is a really exciting and interesting symposium and unusual symposium for you all today. Obviously, GlaxoSmithKline, we're part of industry, and you may not be aware, but our corporate motto is for people to do more, feel better, and live longer. And in that, we have three divisions in our company. We have a division that manufactures pharmaceutical products. We have a division that manufactures vaccines. And we have a division that manufactures what is described as consumer healthcare products. Consumer healthcare products are the products that you can buy in a supermarket or a pharmacy. And we support oral health through our consumer healthcare division. And we are passionate about supporting the FDI's mission, leading the world to optimum oral hygiene or oral health. You may not be aware, but even in 2018, in the most developed economies in the world, we still struggle to get the population to brush twice a day. A ballpark average figure is that we still only have the population, 80% of the population, brushing twice a day, and that means there are 20% of the population only brushing with toothpaste once a day or less. And I think we can all agree that good toothbrushing twice a day for 2 minutes is believed to represent optimal oral hygiene. I say that because we have this unusual symposium. It is a symposium dedicated to our partnerships with the various non-government organizations around the world that are equally dedicated to improving oral health and oral hygiene. We have four speakers today who are going to talk about how GSK partners with them to make an impact on oral health inequalities or behavior and patient-reported outcomes, generate data. So first up, we have Dr. Monica Dominguez, who's going to talk about a partnership with Smile Train, an organization, a charity that's dedicated to eradicating, if that's possible, cleft lip and palate globally around the world, providing access and efficient, effective, comprehensive cleft care post-surgery. We have Dr. Gerhard Seeberger, from the President-elect of the World Dental Federation, the FDI, who is going to talk about a partnership project to generate better oral health data sets for us around the globe. And I'll say no more about that, but that's a partnership that GSK believes is essential and that we're supporting. We have a slight change to the symposium today. We originally had Dr. Chris Fox, who was the Chief Executive Officer of the International Association of Dental Research, Chris came to Argentina, but unfortunately had a family emergency and has returned home to the United States. And so we've been very privileged to have Dr. Angus Walls, the immediate past president of the International Association of Dental Research, to talk with a partnership where GSK is supporting a new generation of researchers globally through an unrestricted grant to the IADR. And then lastly, I will come back and talk briefly about a partnership with a leading British academic university to develop patient-reported outcomes in the area of dentine hypersensitivity. So that's the symposium that we have for you today. As I said, we're going to progress through the slides at pace and hopefully have a dialogue and a discussion at the end. So that's it from me at the present moment in time. I'm going to ask Dr. Monica Dominguez to come and talk to you a little bit about the global charity Smile Train and its recent partnership with GlaxoSmithKline.
Muy buenos días. Muchas gracias.
Good morning. Thank you to the GSK team for giving us the opportunity to share with all of you a little bit of what Smile Train does. Our organization, Smile Train. Smile Train is an international organization. We operate globally to support the treatment of cleft palate. I would like to start my presentation sharing the story of Ever, my friend. Ever was born with cleft palate in a very petite locality in Mexico, Chiapas. When he was 10, hadn't been treated ever, not even a clinical assessment. When we contacted the family, the mom said that unfortunately she couldn't even read or write. She was illiterate, and for her, going to a hospital, even to inquire the options for her child was a challenge because she knew she had to fill in forms or she had to write something, and she couldn't really do that. She couldn't read or write. So she just left her son really grow alone with this condition. This condition is considered, of course, as cleft palate. It is kind of hair lip, and 1 out of 700 live-born are born with this condition. If we think all the people that are affected, it is a public health problem. We need to do something in this regard. We do know that the face is formed by the frontal to maxillary to mandibular processes, and all these processes grow forward and sidewards, and they, of course, merge with each other. Something goes on in this fusion process that it's not 100% fusion. There are many theories in this regard, but what we do know is between the 4th and 12th week of uterine life, babies might develop the cleft palate condition. There are many causes. We do believe that it is multifactorial. There are so many factors that intervene for the cleft palate to be formed. For example, folic acid deficiency during pregnancy, a genetic component. In our DNA, we have the code of cleft palate. We just need an epigenetic challenge to trigger it and have the condition. Also, there are some teratogenic biochemical substances, viruses, biological agents, pesticide exposure. All these situations may trigger a cleft palate condition. As there are so very many factors, it's very difficult to talk about complete prevention. There have been campaigns. Up to now, we have not been able to prevent, not even to reduce the incidence of cleft palate worldwide. So what we do need now is to do something with the person, support them, allow them for full recovery of their lives. There are different types of cleft palates. We find cleft palates on the lip, which is incomplete fissure, unilateral complete fissure affecting just one side of the face, or bilateral fissures that may be incomplete or complete fissures. These fissures may have cleft palate, complete lateral or complete bilateral cleft palate. All these conditions have different types of incidence, and treatment complexity does vary. What does this mean? If we consider about all the things we do with the nose, with the lips, with the mouth, with the palate, on a daily basis, it's been compromised because of the fissure in the palate. Regarding the natural evolution of the disease, we have speech problems, respiration problems, nutritional problems, aesthetic problems, psychological impact on the patient. And even some patients are treated surgically initially, the closure of the lip. There are also some complications that appear later and need to be taken care of. We are talking about the challenge that feeding a baby implies. As moms, we know that feeding our baby is complicated. A baby with a fissure, it's even more complicated. Imagine, it's like drinking water with a straw that has a little hole. You suction, and you don't drink all the water you need. You are filled with air. It takes time and it's harder, and babies don't feed, neither do they thrive properly, neither do they grow in order to have their first surgery. The ear is connected with the nose and with the throat, and the bacteria create ear infections, and there is hearing loss danger. One of the challenges is the lack of information. People don't know that this situation may be in some way remedied, and sometimes they condition that it is a curse, or there is something about the religion, and that they were born as such and they have to live as such, and this prevents them from finding help. Tonio, 78 years old, look at him, or whole families that have this condition, their members. So at dental level, there are many abnormalities: number, position, size of the teeth. There's important collapse because the scar fibrosis has prevented really the maxillary to grow, and we need to assist in the lateral and anterior-posterior development of the teeth. This is an extreme case, but there are situations that people do face when untreated or without proper treatment. So cleft palate has a solution. If we do timely treatment with proper quality, these patients may live a full and productive life. So the fissure, as I have already mentioned, is a condition that we can help. But it's not just the fissure that's important. We do believe that the fissure in itself is part of a human being. The cleft palate, it belongs to a patient who lives in a family, in a culture, in a city, and we need to consider that when we decide to really help this type of patients. Smile Train. Smile Train is an international organization. We are under the Chinese proverb: if you give a fish to a person, you will help him one day. If you teach somebody how to fish, they will feed for a lifetime. So we do partnerships with local doctors who are willing to help these patients, and we finance them, and we give them financing so that they can take care of their children. As we already said, cleft palate is not an easy situation. We need to follow the patients on, and a comprehensive and multidisciplinary treatment, and just those who are there in the locality can assist them. 2 years ago, at global level, we have supported 55 countries. We achieved surgery number 1 million. Number of surgeries is important. It's a cornerstone of treatment, but also we provide productive lives, full lives in people who can integrate into society. This is our footprint, Smile Train, the countries that we are presenting and in which we have programs. Programs in the Americas, 17 countries, including Argentina. And our model is 100% integrated. We know that our all needs and circumstances are complex, and we are supported by maxillofacial doctors, plastic surgeons, speech therapists, phonoaudiologists, also nutrition experts, and we have different ongoing projects to help these people. For example, in Chile and in Mexico, we have fora on cleft palate children. Also, we are helping them so that psychologically they receive support and have the certainty to maybe sing in public, and this really stimulates their speech capability. In pre-surgical functional treatment, this is something that you are much related to. At the beginning, we know that tissues are there, but they are displaced. They didn't really fuse properly. What we do with surgical treatment through devices, intraoral devices and plates, we help the tissues of the columella and also the nostrils may repositioned properly so that the surgeon may have the possibility of operating a simpler surgery, and surgical results are better. It's a great stigmata for children to grow with this type of nose without the nose tip. So this helps them, prevents them from proper school performance. They are biased, and so we have to treat them properly initially. These are the plates we use in a pre-surgical treatment plan. It's done when the baby is small, and this will allow them to reach surgery. Also, mixed dentition, we find, of course, some growth stimulators. These are functional devices and face masks helping us for the mid-face of the face to grow. In general, with the scar, it's as though we were insufflated a balloon and we placed a scotch tape. Therefore, if you insufflate the balloon, everything grows except this part. The same thing happens in the face of our patients. We need to intervene properly, timely, during the growth spurts so that the child may have a harmonious development of their faces. Permanent dentition, in some cases when genetic is not in our side, the mid-face of the face doesn't grow in an EP projection. We need to do orthodontics so that later children may be subjected to orthodontic surgery. And there we do bony fractures in order to really advance the maxillary, so the maxillary mandibular relationship is harmonious as should have been initially. And this is 7 after he came to one of our Chiapas partner centers. He was operated. And what I would like to share with all of you, and with this picture, in spite that he has been operated, there's still so much to be done. We need to approach these treatments in a responsible way. We need to give a lot, allowing kids to grow from a functional perspective, to have a healthy psychological development, and also to give them the certainty that they may be full people, productive people in our world, to have healthy family lives. And this is the partnership we've been having with GSK, and we know at Smile Train that good things will come. And of course, when we talk about cleft palate, we know that hands are not enough. And as I already spoke with one of our colleagues, when you know, but in your hands, you have the power, you cannot not do it. And I'm sure that if one day you wake up realizing that you can fly, the first thing that you will do is try to fly. If you are convinced that in your hands you have power, you need to use it. And these children, these patients are people that need our help. Thank you so much.
Thank you so much. Really appreciate that, and what an inspiring presentation. I think you all found that. Now we're going to transition to Professor Seeberger, who is, as I said, President-elect of the FDI, and he's going to talk about a project that generates data for the global health community.
Muy buenas tardes.
Good afternoon.
Gerhard Seeberger. I am a Bavarian-born, traveling on a German passport, and I'm a faked Italian, but a 100% Italian dentist living on Sardinia Island. Now, this afternoon I would like to talk with you about the FDI Oral Health Observatory, a practice-based approach to filling data gaps and reinforcing oral health advocacy. First of all, thanks to GSK for organizing the symposium and for the invitation to speak about our valued and important partnership on the Oral Health Observatory project. I will cover three main points with this presentation. Firstly, a very brief look at the current state of the oral health data and need for new efforts in this area. Secondly, how FDI and GSK are seeking to have an impact in this area through OHO, working with National Dental Association and dentists to collect oral health data. And finally, the benefit of the data we are collecting and how it can serve our work to advocate greater attention for oral health and needed changes to policymakers. Despite welcome efforts by bodies such as the World Health Organization and the EU, the European Union, to improve oral health data collection, we're still lagging behind data collection for other health issues. For many topics, oral health data is outdated, of poor quality, or not comprehensive in quality, particularly data concerning low and middle income countries. New efforts and approaches are needed to address the persistent oral health data gaps and strengthen advocacy efforts for improved oral health care and public health measures. One example of the need for increased data collection efforts in this area of the psychosocial burden and quality of life impact of oral diseases. In Figure 1, as you can see here, is taken from FDI's Oral Health Atlas and is based on data from the 2010 Global Burden of Disease study from the Institute of Health Metrics and Evaluation. An impressive and important undertaking, the disease-adjusted life years calculations for all conditions in the Global Burden of Disease study are nevertheless based on a restricted conception of quality of life impacts and disability, and therefore recognized by the authors as likely underrepresenting the burden of oral conditions. The underestimation of the oral disease burden has been identified by different actors as a reason for the political neglect of oral health, and as outlined in a paper by Benedetti et al. At the end of 2014. Further data is needed to highlight the importance of oral health and adequate oral health care to ensure greater political commitment. So now I will turn to look at how FDI and GSK are partnering to propose a new approach to oral health data collection through the Oral Health Observatory project. To give a global overview of the OHO project, it uses mobile app and web-based questionnaires to collect data about oral health and oral health care. And the overall objective is to expand and improve standardized oral health data collection by providing an easily accessible survey tool empowering general dentists to take an active role in data collection. FDI launched the pilot phase of the Oral Health Observatory in 2014 in 3 countries. That was Germany, Mexico, and the Netherlands. And the purpose of the pilot phase was to test the first iterations of the OHO app and questionnaires in dental practice. Following this pilot phase, FDI adapted to the OHO app according to feedback and developed the questionnaires with the OHO expert task team, giving greater focus to the quality of life impact of oral health. In late 2016, the FDI launched Phase 2 of OHO in partnership with GSK. Phase 2 has several objectives, namely, to use the improved OHO apps and questionnaires to collect standardized data from at least 10 countries worldwide, to analyze the collected data and create outputs that will strengthen oral health advocacy at the national and international level, and to further assess the relevance and acceptability of the OHO questions and potential barriers to using the OHO app to collect data in practices, thereby informing further adaptations and future implementation of data collection using the app. As Phase 2 progresses, we'll also be able to adapt the Oral Health Observatory data collection tool to reflect FDI's Adult Oral Health Standard Set, which is being developed by FDI's Vision 2020 Advocacy Task Team. The standard set is developed to measure oral health in line with FDI's adopted definition and will be scientifically validated. The OHO tool may also offer opportunities to contribute to this validation. It's right now in this phase, and then it will go into an assessment and reassessment phase in order to test its accuracy. There are 3 separate Oral Health Observatory questionnaires, each with a focus on certain kinds of information. The patient questionnaire is completed by the patient before the consultation and concerns their demographics, oral health behaviors, and oral health related quality of life. The dentist questionnaire is completed during the consultation and concerns the patient's oral health status. And finally, the dental practice questionnaire, which is completed one time only by the participating dentist and concerns their dental practice characteristics, the oral health care system, and the dental profession. We come now to the phase 2 rollout. The Oral Health Observatory project is currently being rolled out in 11 countries in partnership with FDI member national dental associations. 4 countries are already progressing with data collection, with most others finalizing the recruitment of participating dentists and other preparation steps, such as obtaining ethical approval. Participating national dental associations can choose from 2 different practice selection methodologies, according to capacity. The first one is the general study, which uses stratified cluster sampling to randomly select dental practices according to population distribution. Clusters are determined according to the population of administrative regions and urban-rural differences. The extended study is a fully representative random sample of dental practices from a list of all dental practices in the country. And it's based on current NDA participation. Phase 2 of OHO will collect over 19,000 paired questionnaire responses from around 400 dental practices. In participating dental practices, patients are randomly selected to participate according to their arrival in practice. First patient surveyed on the first day, second patient surveyed on the second day, etc., etc. Before completing the questionnaire, patients receive an information sheet and complete a consent form on the OHO app. They then proceed with the questionnaire, which takes around 5 minutes to complete. There's also foreseen an individual dentist participation. In addition to the formal in-country studies being undertaken with NDAs, OHO is open also for them. The dentists can download the app and select Create Account. After they fill in some basic information, they receive confirmation of their username and password and begin the collecting data through the app. With enough dentists, such a mass participation approach to data collection has the potential to drastically advance available data and knowledge in certain areas of oral health research. We come then to the project outputs and the OHO Advocacy. The FDI will analyze the data collected through OHO to create advocacy materials which can be used by the FDI, the national dental associations and other oral health advocates to call for more attention for oral health and specify policy changes to improve oral health and care systems. Given the data collected, we expect these to be particularly impactful when focusing on the quality of life impacts of oral health and dentist perceptions of the profession and oral health care systems. The National Dental Associations will also receive the anonymized raw data collection for their country for use in their own research and advocacy projects. In addition, FDI is developing a visualization platform that will be available on its website, allowing users to interact with the data and display it in a variety of ways, including charts and maps. The Oral Health Observatory dentists will also be able to create visualizations using the data from their practice, offering insights into various aspects of their patients' oral health and experience. Now, just to understand a little bit more, to learn more about the Oral Health Observatory and have the chance to interact with the project's expert task team, please attend the OHO Symposium being held tomorrow from 14:30 to 15:30, means 2:30 to 3:30 in the meeting room 7, 2:30 to 3:30 in meeting room 7. Now, finally, I conclude in thanking GSK for the opportunity to present at this symposium, and more importantly, for their ongoing collaboration with the OHO project, and in person, Dr. Steve Mason and Kavita Sood from the GSK, and the FDI staff, Dr. Virginia Hornborter and Sean Taylor, which you can contact them at the FDI booth. Thank you very much for your attention.
Thank you very much, Dr. And I'm sure there will be questions on the OHO app at the end. Next is Professor Angus Walls, a long-time collaborator with GSK, immediate past president of the IADR, talking about how the IADR supports next-generation researchers with support from GSK. Angus.
Steve, thank you so much for those kind words of introduction, and also for the opportunity to share with colleagues here in the audience some of the work that is delivered through the IADR, but in partnership with GSK. For those of you who aren't familiar with the organization, the IADR is the world's largest oral health research community with about 11,000 members globally, and is organized into divisions and regional structures. I've just come to this meeting from the divisional meeting in Brazil as an exemplar of that. One of the roles of IADR is to try to develop research capacity. And in that role, we partner with a number of commercial organizations to help to support research globally in a variety of ways. And this partnership is critical to the development of individuals. One of these partnerships is with GSK, and the particular partnership with GSK are our Innovation in Oral Care Awards. Each of these awards, and there are 3 annually, is worth $50,000 to the participant. So we're talking about a very significant investment here in terms of helping research workers to develop research concepts and ideas. And again, for those of you who are not in the research community, it is relatively straightforward to find small sums of money to develop a research concept. It is really difficult to find that next grant to be able to take that idea into something which has evidence and sufficient evidence, then to be able to go to a national funder or an international funder to provide a clinical trial or a study which will be of global reach and significance. And it's in that intervening area that these support monies delivered by GSK, but solely through IADR, are so valuable. The program was started in 2003, so 15 years ago, after some discussions that were led at that time by John Clarkson, who was the president of IADR, and set up an independent review panel with the IADR past president John Greenspan to take this program forward. And the first awards were made in 2004 at the IADR General Session, and yes, it was in Honolulu, Hawaii. Sadly, it's the only time the IADR has ever been to Honolulu, but it was there, and I was very pleased to be there as part of that program. The concept is that there is a competitive award towards the development of innovative and novel compounds, biomaterials, or devices that can be used by the public. So a very broad portfolio of research can be supported through these awards. And just some ideas about what has been supported over the years: inhibition or removal of biofilms adhering to natural or artificial surfaces, adhesives for removable prosthetic devices, modifications of surfaces to inhibit biofilm formation and prevent other stains or odors from starting, inhibition of tooth wear or tooth surface loss and gingival recession, and amelioration of their effects, and very obviously as part of that, dentine sensitivity, and counteracting the oral effects of dry mouth, systemic illness, hormonal disturbance, or physiological aging. So a very, very wide portfolio of research supported by this initiative. Critically, GSK have very little to do with the awards process. The applications are submitted to IADR and reviewed by an independent IADR Oral Care Awards Committee in a confidential manner. GSK is not privy to the application or review process and does not influence the outcomes. The awards themselves are provided in the form of an unrestricted research grant, which carries no obligation to the recipient's organisation for licensure, patenting, or transferring confidential information. This is philanthropy in a commercial and industrial scale. And so the call for applications is initially advertised on the IADR website. The applications are reviewed by an independent panel. They are screened initially. We receive between 20 and 30 applications each year. They're screened down to 8 finalists. The finalists are screened once again. And then one of the IADR's governance committees, the Performance Monitoring Audit Committee, reviews the outcomes of the independent panel and makes a recommendation to the IADR board. And the results finally are announced at the IADR General Session, where they are both announced at the opening ceremony and in a private reception, again supported and funded by GSK, to acknowledge the award holders and past recipients. And just a flavour from some of the past awardees about what these grants have enabled people to do. David Wong, one of the leading lights in salivary diagnostics. We can envision the day that we can go into a health check and at the same time be monitored non-invasively for important diseases and metabolic disorders or even cancer. David has had 2 of these awards to develop his salivary biomarker technology. Rina D'Souza, who is my successor as president of IADR, it was a transformative project that I think career-wise placed me in the field of regenerative dental medicine where I would not have been otherwise. It allowed this established research worker to make a step change into a different field and to develop a completely new research program. Peter Holbrook from Iceland. My advice to dental professionals or scientists considering oral health research would be to consider collaboration with commercial companies, and GSK is a fabulous company to collaborate with. And one of the more recent research workers, Rob Alaka from the UK. One of the great things about the GSK IADR Innovation in Oral Care Awards is that it is open to people worldwide, which is fantastic. Anybody can submit and support an application to this program. And critically, many of these individuals and some of the other awardees, and you see all of the awardees there in front of you on the panel, have been able to use this grant to leverage further funding. They've been able to develop evidence at a level which has allowed them to go to a national funder or an international funder to go for a larger clinical trial, an independent research cohort grant or something of that sort. But without this funding from GSK, that would not have been possible. So over the last 14 years, IADR as an organisation has been able to provide 46 of our members with over $3 million in research funding to advance their research for the improvements of oral health, with very significant impacts as far as the public and your patients are concerned. GSK is a science-led global healthcare company with a purpose to help people to do more, feel better, and live longer, as you heard earlier. And the IADR helps or hopes to try to allow its members to advance their research, improve grant writing skills, and collect pilot data for other grant applications. That is the purpose of this award program, which is so successful. And of course, the target is to improve oral health worldwide for the public. And so what of the future? I'm delighted that GSK is continuing to support this program, and we're very grateful to Steve, to Teresa Leah, who manages the consumer healthcare group in GSK, for their continued support. And the application deadline for 2018 is on December the 14th. So there is still opportunity for any of you who are research workers in the audience who wish to consider an application for this program. Full details are available, obviously, from the IADR website, and you can see the web link there for further information. Well, on that note, I'd like to close, thanking once again GSK the opportunity to acknowledge their support to IADR and the world's research community, and I look forward to answering any questions in due course. Thank you very much indeed.
Thank you very much, Angus. And before my last presentation, I'll just reiterate, why is partnership important? And why does GSK put great store on our partnership initiatives? And it's quite simply that the field of oral health is too big. No one organization can manage it on its own, is our philosophy, and certainly within GSK. We know that we need to partner with the external world to get things done and to improve oral health worldwide. And that's why we're here today, just to share a little bit of that. I'm going to switch gears a little bit and just talk about one of our research partnership activities with a leading British university. And everybody knows that one of our major brands is Sensitine and dentine hypersensitivity. And the condition is well understood. Once you've generally managed dental caries and you have periodontal disease controlled, then the concern can move to dentine hypersensitivity. It can be caused by dentine being exposed through over-vigorous brushing, or perhaps a little bit of gum recession. And once the cementum has been exposed, then erosion or abrasion can quickly remove it, leaving the possibility of dentine hypersensitivity to exist in a subject. And epidemiologically, although this is a subject of some debate, but somewhere between 1 in every 3 people suffer from dentine hypersensitivity, a small exposed piece of dentine. But interestingly, in a very recent study, pan-European study, 3,000 subjects of young people, 18 to 35-year-olds, we identified that as many as 2 in 5 subjects of that young age group were exhibiting dentine hypersensitivity. Furthermore, when you take that and look at some of the historical research, we're aware that many of the many of the patients do not talk to their dentist about the condition. They actually don't seek dental advice. And Martin Addy in 2002 postulated and hypothesized that could be something to do with fear, something to do with perception, opportunity and access is in there, are some sort of hierarchical concerns, and clear development of coping strategies. Well, all of those are oral health related quality of life type statements. And so with the University of Sheffield in the United Kingdom and the University of Toronto in Canada, we initiated a project to develop what we call a condition-specific oral health-related quality of life instrument around the area of dentine hypersensitivity, and followed it through to full validation. So the questionnaire is validated, and that whole initiative, through working with the University of Sheffield in partnership, took about approximately 7 years to complete. But at the outcome of it, I'm going to take you through the DHEQ, the Dentine Hypersensitivity Experience Questionnaire, which is now free access, globally available, being translated into multiple languages, and being validated in China, France, Germany, and I think Nigeria. So just to talk a little bit about the quality of life elements and whether this small condition actually affects people's behavior, and does it stop patients doing what they want? How do they feel about themselves and their interactions with others? And so with this condition-specific validated instrument, we can now measure these impacts. And rather than me talk about everything, I thought we'd show you a little video of Dr. Peter Robinson, Professor Peter Robinson, Dean of Research at Bristol University, UK, who himself went on this journey of understanding about oral health-related quality of life of this seemingly innocuous condition.
I'm Peter Robinson. I'm Professor of Dental Public
And
Health
we
at
have
the
no
University
sound.
of Sheffield School of Clinical Dentistry. One of the things about dentistry is that dentists have to try so hard to learn the technical aspects of treatment that it's easy for them to forget the person attached. And yet, of course, the person's crucially important. With a condition like dentine hypersensitivity, patients tell us they've got the sensitivity before we know to look for it. And then it's patients go out and buy products, who go to the dentist, and so on and so forth. We learnt a great deal about dentine hypersensitivity during the development. The first thing really is that in the textbooks and things, just simply described as a short. And on the face of it, that seems a very simple thing. The thing that really surprised us how complicated the effects of that people's everyday life. Pain if I had a cold drink or ice cream. But then we discovered that people had quite elaborate mechanisms to cope with the condition, avoiding things by eating on different sides of their mouth, avoiding social situations where they might be presented with cold drinks that we would never have anticipated. I think the development of DHEQ could affect clinical practice in lots of ways, some of them obvious and some of them perhaps a bit surprising. First and foremost, dentine hypersensitivity has always been an enigma to dentists. We diagnose the condition when we can't see anything wrong with the teeth. So that if the patient says that they're in pain but we can't see anything wrong, then we diagnose this condition. So immediately it's an enigma to us. Now, having a way of measuring the effect of the condition on people's everyday life means that we've got much greater sort of clarity of what's happening. It means then that we've got a language and a way of talking to our patients and of finding out whether or not the treatments that we offer really benefit patients, which I don't think that we've had before. Less directly, I think that patients will be really grateful for that. We found in the development of the measure that patients were often a bit frustrated with dentists because the patients would say they had the sensitivity and then the dentist didn't really have very much they could do in response. So that I think that patients will quite welcome dentists being able to take more of an interest. And from the perspective of a dentist, that's a practice builder as well.
So there's Peter talking about some of the things that he learned with the Dentine Hypersensitivity Experience Questionnaire. It takes us from clinical biomedical indicators of disease to patient-reported outcomes, oral health-related quality of life. It's got 48 questions. There's some very simple questions at the top, and then some very probing questions in the 5 domains of psychosocial structure. So the domain on restriction of activities, the adaptation domain, the emotional domain, the social interaction domain, and the identity domain. And I'm just going to take you, one question slide first. It's been fully validated through the whole quality of life process, including the construct and the validity, etc. That's what's taken the time to actually confirm that it is measuring what it sets out to measure and that the results are robust and reliable. And I want to take you through just a few observations of what people, patients, consumers who have dentine hypersensitivity, who suffer with dentine hypersensitivity, might react when faced with a questionnaire. So the first one is unsurprising. Every clinician is aware that patients will complain that the condition of dentine hypersensitivity impacts and takes pleasure out of eating and drinking. But the number of people who responded positively to the scales, so that's strongly agreed, or slightly agreed, was actually 70%. So 70% of patients actually confirmed that dentine hypersensitivity takes pleasure out of their eating and drinking. As I said, that one is perhaps less surprising than the one I'm going to take you through here, which is hidden in the social domain, which, when asked if people would hide or conceal the way that they were eating because of the sensations in the teeth, again, adding the three boxes together, strongly agreed, slightly agreed, 26% of consumers' patients actually confirmed that it impacts how they eat in a social environment, and they prefer to be not visible if they can. Some other ones in the emotional and identity domains, that the sensations in the teeth are annoying, 86% of sufferers. But what about this one in the middle, where people with dentine hypersensitivity, 33% almost, are indicating that it's making them feel old. And remember that epidemiological statistic I started with, where 2 in 5 18 to 35-year-olds in Europe have dentine hypersensitivity. And this very small innocuous condition is starting to make them feel old. The last one, about the need to bite into small pieces to process the food, is also quite significant and quite surprising. Now, I just want to bring this to life, because we went on from this and thought about, okay, if this small innocuous condition is really having such an impact on people's oral health related quality of life, what might it look like? And I've got a small video here. It's been shot in the most modern technology, the ultra high definition camera, and the video footage has been slowed down. It is focused on the muscular changes in the face when people get faced with a condition of dentine hypersensitivity, and it's here to show you how they are reacting themselves. So that's how the facial muscles are reacting when they exposed to dentine hypersensitivity stimulus. I've got one more slide to just bring it to closure, just to confirm that the instrument has been validated against the clinical index, and this is a graph which on the left-hand side is the biomedical measurement, the clinical measurement of dentine hypersensitivity, and the right-hand side is the change in the oral health-related quality of life as measured by the DHEQ instrument. And I think you can see that the two measures in a clinical study, a clinical trial, parallel themselves nicely. So this was to share with you how we partner with academia and how we partner with researchers to have created an open and transparent condition-specific, validated quality of life instrument. It's not proprietary to GSK. It is available for researchers worldwide and clinicians to utilize to help better understand their patients and follow patient-reported outcomes better. So with that, I'm going to bring the symposium presentation section to a close. I'm going to ask my three fellow speakers to make their way to the dais, and then we'll take any questions that there is from the floor. If you will just give me 20 seconds to move over there, I will do that. Actually, I think I might stay over here and just pass the questions over there. So If we can, are there any questions from the floor, please, to any one of our speakers? For the purposes of the translation and everything, would you come to the microphone, and that will help the speakers hear the question, if necessary, translate the question, and the first one from the front microphone. Thank you very much indeed.
Hello. Thank you very much for your nice presentations. I'm an endodontist, Konrad, from Turkey. And I want to ask Mr. Gerhard about the data gaps and how we're going to collect it with an app. Because due to the new laws and bylaws that are regulated both in EU and also in Turkey, it is strictly against to collect data in such manners, especially with an app, right, even if the patient accepts it. So it's against the law because it's also against the human rights. So how are we going to overcome this? Because right to health and right to health care is about human rights. And when you look at all the data collection, collection of data, the laws and bylaws, it's all about not to give these data or collect these data unless it is strictly necessary for the patient's benefits. So how are you going to overcome this, or what is your perception and your idea of to collect these data and accumulate these data in one, all these international data in one app, so all the other dentists can see? And moreover, this data can be uploaded by anyone. So people who are not dentists or just maybe another company can actually see these data. These are sensitive data, health regulative data, and they will be able to be open to any people who can upload the data. So what is the perspective of GSK about this perception, the health regulations, the data collection regulations, especially in EU? Thank you.
Thank you for the question. I'm going to ask Dr. Gerhard Seeberger to respond on behalf of the FDI. Gerhard?
First of all, thank you very much for your questions, which I would split at this point in two parts. And the first part would be the ethical part. And here I can say, well, you have ethical committees in your country, as I have in my, let's say, country where I'm born and the country where I'm practicing, which make both part of the EU. We very well know that some of those countries, or let's say the national dental associations of countries that wanted to participate in the Oral Health Observatory, have this kind of difficulties. And let's say roughly I can say that this is your part in this in order to get hooked on, or how you can get hooked on. And in some countries the study is exempt. The second part would be then the data privacy. And I do not know if you are relying or referring to the general data document of GDPR. Well, that's the document, the general data protection in Europe. And this is, I would say, something that we would not further look into, as it is conformed to that. And the data is transferred to, I would not say a monkey-proof and secure server in the FDI, but it's going into that direction. The data are really secure and well encrypted and stored safely. And as the FDI is based in the canton of Geneva, this complies also with the Swiss law and the GDPR data regulations, and can adapt certain project elements and agreements to meet the NDI needs. So I would at this point definitely, if you want to have further information, and I hope I answered part of your question, please refer to Sean Taylor directly, as unfortunately our scientific manager, Virginia Hornborn, will be only until the end of the month with us. But Sean Taylor, he will be the right person to contact. Did I answer your question? So thank you once again for having it brought up.
Okay. Do we have another question from the floor? If you do, would you please approach the microphone? It's a little challenging and difficult to see. Okay. Apparently, I was unaware of that, but with webcast questions, there's a novel innovation for us all. Question to Smile Train. What is the challenge Smile Train are facing with the Smile Train program? I guess, what is the greatest challenge Smile Train feel that they're facing? Monica?
Thank you. Bueno, dentro de los...
Well, among the most important challenges the Smile Train has is first to create real awareness, people not having information, not knowing what cleft palate is all about. That's a condition that must be taken care of, and our partner centers provide care for free. This has meant a very important challenge to reach many, many people. If we can share this information, and when we have the information with us, we are like spokesperson, we disseminate the information.
Thank you, Monica. Any more questions? I think that's it, and actually that would be quite fortuitous because it will allow people to get to the World Oral Health Forum, which is going to start, I believe, in about 10 minutes in not room over in that direction, I believe. So I'd like to thank everybody for attending and for listening, for being here today, and it's been a great privilege to be with you all. Thank you very much indeed. One small last announcement, and that is there is a feedback form. Feedback is very important to GSK, and we would like to hear your opinions of the material that we've presented today and how you felt it was delivered and what your guidance would be for future symposiums. So if you could take the 5 minutes, 2 minutes, just to complete both sides of this single sheet of paper and hand it in at the back, that equally would be very important to us. Thank you very much indeed.